On this Saturday night, the return of restrictions. The anxiety over the rise of Omicron.
We may have to consider something more drastic or draconian.
The evolving rules ahead of the holidays. Long lineups for COVID-19 tests.
We've been calling for rapid tests to be deployed for over a year now.
Why critics say the government mismanaged an important tool. Plus, boisterous Boris, Britain's Prime Minister, is put on notice by his own party, and the court comeback.
I just looked at it and I'm like, this may be the last time I see you.
How a team rallied behind a beloved coach.
Global National with Robin Gill.
Good evening and thank you for joining us. All around the world and in Canada, new restrictions are being imposed because of soaring cases of COVID-19 involving the more transmissible variant Omicron. The World Health Organization says Omicron has now been detected in 89 countries. It's spreading rapidly, even in places with high levels of immunity. The number of COVID-19 cases involving the variant is doubling every 1.5 to 3 days in countries where there's community transmission. Canada is one of those countries, and there are projections that Omicron will soon overtake Delta as the dominant variant. Just a week to go until Christmas, all the provinces and territories are keeping an eye on holiday festivities, hoping they don't turn into super spreaders. David Aiken has our top story tonight.
That shot scores!
The Montreal Canadiens snapped a 7-game losing streak on Thursday, and no one was there to see it. The hockey club kept fans away after being asked to do so by the Quebec government to stem the spread of COVID-19. It's a different game next door in Ontario, where the Toronto Raptors, for example, will still be able to play in their arena Monday in front of as many as 9,000 people.
The hypocrisy of us being told that we can only gather with 10 people in our homes, but can go and join thousands of other people in arenas or hundreds in the community and restaurants and bars is unfortunate.
In the meantime, business owners are desperate for financial help in the face of new restrictions that come into effect at midnight Saturday.
Right now, the state of the nation of small businesses, very sad. Only 35% are at normal revenues for this time of year. The average COVID debt, $190,000 per small business. 18.5% of Ontario small businesses are actively considering bankruptcy.
Ontario is also struggling with its rollout of rapid test kits, a crucial tool to help stem the spread of Omicron.
We've been calling for rapid tests to be deployed for over a year now, so I'd say it's very poor. It's very clear that rapid tests are a useful tool. It could have been very useful, for instance, in reducing the number of outbreaks in our elementary schools.
Ontario used its provincial liquor store chain, the LCBO, to distribute the tests. There were long lineups when the test arrived Friday morning, but a day later, they're all gone. Also missing, a system to record the results of those rapid tests, data that is crucial for responding to the spread.
I think there'll be plenty of people who will get positive test results who will not want to then go out to get a PCR confirmation. It'd be great to keep track of those.
Ontario's public health units, meanwhile, are scrambling to get as many boosters in arms as possible. In Kingston, Ontario, which now has the highest regional case rate of COVID-19 in Canada, officials organized a drive-through clinic to speed up the process.
Early morning start, great turnout, a lot of people showed up.
If there's one constant Canadians can expect this holiday period, it's change. All governments were warning this week as they announced new restrictions, be they for the border or here at a shopping center, is that public health rules will change and change frequently. Robin.
It's an evolving situation. David Aiken in Ottawa. In Quebec, there is a worrisome rise in hospitalizations and ICU numbers. That's prompted the province to reintroduce a series of measures aimed at slowing the spread of Omicron. As Elizabeth Zogalis explains, more restrictions could be on the horizon.
With this pandemic, we cannot rule out anything.
Speaking at Thursday's press conference, Quebec Premier François Legault says he had no choice but to once again tighten restrictions as the Omicron variant quickly spreads across the province.
The measures we announced today are the measure we think that will be enough to change the situation.
But health experts say those rules must be adhered to. The situation could get much worse.
We really need to follow those measures to the letter, and in fact, even do more than what the government recommends in terms of protecting ourselves for our collective good.
Starting Monday, stores, bars, restaurants, theaters, and gyms will operate at 50% capacity. Private gatherings will be limited to 10 people.
The government recommendations are the basic recommendations. It is like the bargain bin level of what we should be doing, but we should be trying to excel.
And many venues are. Le Grand Ballet, one of the biggest ballet companies in Canada, is cancelling its weekend performances of the Nutcracker, and remaining shows will be postponed until further notice. The Montreal Canadiens game scheduled at the Bell Centre Saturday night was also postponed, and morning practice called off.
Hopefully, over the next 2 to 3 weeks, that we can get that curve to come down a bit.
Montrealers are getting the message.
I had some tentative plans for New Year's Eve, and I had 2 parties, work parties. I work in a hospital. Everything's been canceled.
I'm definitely meeting less friends, maybe 1 or 2, but definitely not a big gathering.
On Saturday, the Premier posted a message on Facebook thanking all Quebecers for their patience. He reassured eligibility for 3rd doses would be expanded to all adults as soon as possible. Elizabeth Zogalis, Global News, Montreal.
British Columbia is bringing in new restrictions as it struggles to deal with soaring COVID-19 cases and rising Omicron concerns. The new rules are slated to kick in Monday, but as Omar Alghabra explains, several major sporting events scheduled for this weekend have been cancelled because of COVID.
The puck was set to drop in just 4 hours' time when the decision was made to cancel not 1, but 2 Vancouver Canucks games at Rogers Arena this weekend as more players entered COVID-19 protocol.
We're disappointed, but safety comes first, the safety of the players, safety of the fans, and I think this is the right decision.
Off the ice, it's the same story. For days, COVID-19 testing lineups in Vancouver have sometimes stretched 2 hours. While many are scrambling to adjust to new restrictions on social events and gatherings in BC just days before the holidays and ahead of what will likely be a surging Omicron variant wave of COVID-19.
I recognize that this unrelenting uncertainty and this evolving situation is very unsettling for many people, and it can cause a lot of anxiety, depression, and discouragement.
Friday, Provincial Health Officer Dr. Bonnie Henry acknowledged the hardships people had faced in the recent months, but said the new variant had left them with little choice.
On Vancouver Island. It is moving quickly, and so must we.
Hey, how are you? Good. How are you?
Indoor personal gatherings like holiday get-togethers are limited to hosts plus a maximum of 10 people or another household, while all must be vaccinated. Sports tournaments are canceled. Venues with capacities over 1,000 are reduced to 50%, and a uniquely targeted restriction suspending organized New Year's Eve parties and events unless they are seated without dancing or mingling.
It's a complete surprise that we've gone from planning for 100% capacity back to 50% capacity. Puts us in a unique position where we're moving forward because it's too late to back out.
The restrictions are in place as of Monday, with the province expecting Omicron to surpass Delta as the dominant strain of COVID not long after. Omar Alghabra, Global News, Vancouver.
The rise of Omicron across Canada and around the world has prompted the federal government to change the travel rules again. Starting on Tuesday, all travelers returning to Canada, regardless of the length of the trip, will be required to take a pre-arrival PCR test. For more on the new rules and why they're being brought in now, let's go to our Ottawa Bureau Chief, Mercedes Stephenson. Mercedes.
Robin, so many Canadians have waited patiently, following the rules, getting vaccinated and masking up. They were excited to travel to see family around the globe this Christmas or take a sunny vacation somewhere warm. Now that's all on ice, as Ottawa is yet again advising against leaving the country in the face of the rapidly spreading Omicron variant. With health officials saying the most significant Omicron threat in Canada right now is community transmission, the government has faced criticisms from some sectors for cracking down on international travel. So I asked Transport Minister Omar Alghabra to explain the science behind his government's decision.
The science behind it is that, which makes a lot of sense, is the less people have opportunity to interact with other people, the less risk they put themselves in. And if they are abroad, if they are internationally, God forbid they contract COVID, we're at a disadvantage as a government or as a public health system to offer services to Canadian citizens, but also there might be at risk of being stuck in that country.
Starting Tuesday, all people arriving in Canada will have to produce a negative PCR test, regardless of how long they've been out of the country. That means anyone planning a quick trip to the United States will no longer enjoy a PCR test exemption for getaways that are less than 72 hours. Alghabra cautions anyone who may travel because of the rapidly evolving situation with the new variant that means you could see a lump of coal in your travel plans that leave you stranded abroad if you choose to leave Canada.
But also to protect them against any sudden changes of border measures, either in Canada or around the world, where we don't want to see any Canadian get stuck or having to deal with any symptoms abroad.
You can watch the full interview tomorrow on the West Block. Robin?
Mercedes Stephenson in Ottawa. Thanks, Mercedes. The U.S. is also seeing a surge in COVID-19 infections. Delta remains the dominant and most deadly variant in the country, but at least 41 states are reporting Omicron cases. Experts say millions of Americans could soon be infected with the highly transmissible variant. Jennifer Johnson reports.
From state to state, Americans are waiting in long lines to get tested for COVID-19, as the Centers for Disease Control predicts as many as 1.3 million new cases of the virus by Christmas.
It's unimaginable to have to go through another winter where you are overwhelmed and you have so much death and misery around you.
New York on Friday recorded its highest single-day number of new infections, more than 21,000. Due to the recent spike, there will be no live audience for the taping of Saturday Night Live, and the show will have limited cast and crew. A week before Christmas, the Rockettes have canceled the rest of this season's shows. Schools are closing, pro sports teams across leagues are postponing games. It's COVID deja vu, with expectations more than 100 million Americans will travel between now and New Year's.
It makes me nervous, but I'm boosted and my son's very good at wearing a mask.
More than 800,000 Americans have already died of COVID-19. The CDC is predicting as many as 15,000 new deaths in the next 3 weeks. The unvaccinated, over 90 million, are driving up those numbers.
For the unvaccinated, you're looking at a winter of severe illness and death. For yourselves, your families, and the hospitals you may soon overwhelm.
Despite the staggering numbers of deaths, Americans remain divided over vaccines and mask wearing.
A lot of people don't really seem to care about the neighbor as much as themselves.
Doctors believe the vaccine and boosters will give the best protection against the new Omicron variant, preventing the majority of hospitalizations and deaths. But there is still too much unknown about that strain.
It appears to be about twice as transmissible as the Delta variant. There's some suggestions that it causes less severe disease. However, the information that we're getting on that has been in young, relatively healthy populations.
This latest surge comes as new studies show 1 in 5 U.S. healthcare workers have quit their jobs since the pandemic began.
We're tired, the hospitals are stretched, resilience is low.
The doctors and nurses who were left are bracing for a winter wave that could be just as bad as last year's. They're begging people once again to get vaccinated and get their booster shots. Jennifer Johnson, Global News, Washington.
The UK is reporting more than 90,000 new cases today, and London's mayor has declared a major incident in an effort to help hospitals cope. Calling a major incident allows more coordination between different public agencies in the capital. London is reporting nearly 26,000 new infections today, and Omicron accounts for over 80% of these new cases. Hospital admissions are going up, so are staff absences.
It's really important Londoners understand how serious things are. The best thing Londoners can do is to get both vaccines and the booster. They provide extra layers of protection. The really bad news is those in hospital, the vast majority are unvaccinated.
47% of people over the age of 12 in the UK have received a booster. People in the Netherlands are rushing to finish holiday shopping before a strict nationwide lockdown starts tomorrow. Only essential businesses will be open. All events have been canceled, and gatherings are limited to 2 people from different households and 4 on holidays. So far, it's the strongest reaction to Omicron in Europe and will last until at least mid-January. Coming up, is it bye-bye Boris? The bad news facing Britain's Prime Minister. British Prime Minister Boris Johnson has managed to avoid political damage until recently. This week, his Conservative Party lost a seat it held for 2 centuries. And then the Cabinet Secretary had to recuse himself from leading an inquiry into Christmas parties at Downing Street during lockdown. It turns out one of those parties was held in his own office. As Redmond Shannon explains, all these headaches have Bojo's own party turning on him.
A by-election calamity for the British Conservatives.
3, 2, 1.
Boris Johnson's ruling party defeated in a riding that has voted Tory for 2 centuries.
I totally understand people's frustrations. I hear what the voters are saying in North Shropshire, and in all humility, I've got to accept that verdict.
Amid scandals, infighting and poor poll numbers, the once Teflon-like leader is now in trouble. For a start, the by-election was avoidable. The local Tory MP had been found guilty of breaking lobbying rules. Johnson tried to stop him being suspended, but after a backlash, the Prime Minister U-turned and the MP had to quit.
I've accepted that it was a mistake and that it was my mistake.
Then came his response to a wave of allegations that Tory staff held Christmas parties last year while indoor mixing was banned.
I can tell you that the guidelines were followed at all times.
Only for this video leak to emerge from Downing Street.
This is recorded. This fictional party was a business meeting. And it was not socially distanced.
Plus a photo of Johnson himself allegedly hosting a trivia night.
The noes to the left, 126.
Add to that a quarter of his own MPs rebelling against tighter pandemic rules. And it's time for some British baseball metaphors.
First of all, the Conservative Party in the House of Commons earlier this week. Now this result. One more strike and I think he's out.
Strong words from his own ranks for a leader whose carefree style may be wearing thin.
From being a kind of, bumbling, rules don't apply kind of person that everybody sort of laughed along with, it's now become, this guy doesn't follow the rules. He's become the issue.
Political watchers think Tory MPs believe they need new leadership before the next election, more than 2 years away.
I wouldn't be surprised if there's a leadership challenge in the summer.
Johnson has defied odds before, but could now be facing his toughest battle yet. Redmond Shannon, Global News, London.
Still ahead, hundreds of thousands of people are forced from their homes after a powerful typhoon hits the Philippines. The Coast Guard is still trying to rescue people trapped on roofs and in trees in parts of the Philippines, which was battered by a deadly typhoon Thursday. At least 31 people have been killed since Typhoon Rai made landfall, the strongest storm to hit that country this year. The storm is set to move through the western islands over the weekend. At least 15 people are dead after a gas explosion under a bank in Pakistan's largest city. The blast happened in Karachi. Local police say something ignited gas accumulating in the sewer beneath the building. But what caused the spark is still unclear. More than a dozen other people were injured in the explosion. Up next, the power of teamwork when players get behind their coach. When Sheldon Guy, a high school basketball coach in British Columbia, lost his vision, he decided to bench himself. He was struggling emotionally with his new reality, but his players wouldn't let him quit. And as Jay Durant reports, the power of teamwork helped him make a comeback on the court.
Stay back, reverse, reverse! With his son Jaden by his side and his players there for support, Sheldon Guy is still doing what he loves. Middle, Izzy, middle! Just 3 weeks after his vision quickly started to disappear, leading to a heart-wrenching moment with his son.
And I just looked at it and I'm like, this may be the last time I see you.
And so that was at the stairs. So sorry.
One step.
Anterior ischemic optic neuropathy is now claimed sight in his left eye, 6 years after a different ailment took the vision from his right.
So 3 steps.
Sheldon was able to adapt the first time, but this was a darkness he had never experienced before.
I was in the hospital and I just thought about popping pills and going to sleep and never waking up again.
But then the messages came from family and friends and his players from Langley Secondary.
One of the girls said, the only reason I joined basketball was because of you. She said something like, I don't even like basketball.
Sheldon.
Izzy. Who's that?
Sarah Morrison.
Hey, how are you?
How are you doing?
Come here.
Now, early into their new season, they're finding ways to do this together.
I'm so glad you're here.
Okay, ladies.
Longtime friends in the basketball community are just learning about what has happened to Sheldon.
The fact that he shows up and it's just happened to him, and I don't even know all the details, but I know the guy that he is.
And hey, ladies, if you have the ball fake, see where the defense goes. Take it!
Sheldon Guy says basketball has saved his life, and now for a second time he'll find a way to prevail. He can see some outlines, but doctors say it'll never be the same.
Let's start pulling and start taking some shots, okay?
Guy isn't about to give up. Naturopaths say there is a chance he may be able to reclaim a percentage of his vision, and that's the hope he'll always hold on to.
I will see again, 100%. We can do this conversation in your office. I'll walk in there myself. I will see you. So I will see again. Thank you. Oops, sorry. Good job, ladies.
Jay Durant, Global News.
Sorry.
What a great story. And that is Global National for this Saturday night. I'm Robin Gill. Tonight, your Canada is a snowy evening in Cochrane, Alberta. We would love to see your corner, so please keep sending your photos to viewers at globalnational.com. Thank you for watching, and I'll see you back here tomorrow. Have a great night.